Hello and welcome to our Fulfill Your Potential series of sessions. This first session is focusing on developing the private side of your practice, and as such will be of interest for those of you who currently do very little private work. My name is Katrina Walsh. I'm a clinical advisor with Roderick's, and prior to COVID had started to run some practice efficiency sessions, a large part of which involves speaking about offering private options, which is what I will speak about today. Just bear with me while I share my screen. Okay, so with me. Right, what we'll speak about today is our duty to offer private options, the barriers to offering private options, the features, advantages, benefits model, and also how to get started on fulfilling your potential. Okay, so in order to offer options in line with GDC principles, we really should be offering relevant options, including private options, to all patients, whether it is something that is within our own competency zone or something that needs to be referred to our specialist or special interest colleagues. If you're a dentist who feels that you're doing your patients a favour by limiting your offering to NHS options, then I think it's important that you're clear that really you're doing them a great disservice. It isn't for us to decide what our patients might want. We need to offer them options and let them choose. Secondly, we need to communicate effectively. Clearly, we're aiming to be completely transparent about what is available on the NHS and what is available privately. And the FP17 form supports us clearly with that, as it is, it states that cosmetic treatments can be availed of privately. Regarding consent, although we have all been hung up for quite some time on signatures, as we know now during COVID times, in order to reduce contact, we're simply writing COVID instead of a signature. But actually pre-COVID, as stated in the standards in Principle 3, it is the discussion that takes place with your patient that determines whether consent is valid. And also, you must document the discussions you have, including what option, if any, the patients decide to take. So whilst the whole idea of offering patients options is peppered throughout all of the principles, really, in a nutshell, it's these three. The first one, we have to put working in patients' best interest. We need to offer options. We need to communicate effectively, explain options. And the third principle, to gain consent, we need to have a full discussion and make sure we document that discussion. So if we move on now to considering the barriers to offering private options, think about what currently prevents you from offering every private option to every patient for treatment, where it's appropriate, okay? One of the most common thing that is said to me regularly is perceived lack of time. So lack of time, perceived lack of time. Are we as efficient as we might be? How can you improve your efficiency elsewhere? Do you need to look at how you work with your nurse, develop routines? This can be valid whether you're working with an experienced nurse or an inexperienced one. There's nearly always room to improve. If you have a new nurse, it will definitely be more work initially, but some time spent early on advising and encouraging will pay dividends later. Are you utilising them to support you with your note writing, ensuring they look ahead to what you're doing during the day, have lab work out and other equipment you need? Find that elusive luxators that has disappeared into a different surgery, the one that you like to use. Are you being as efficient as you can be during these times, making calls to patients during follow time? Thankfully, follow time is reducing and will reduce further as all of you get your Winix machines, but there is still time to fit in a call or two. Finally, on the lack of time side of things, certainly pre-COVID, having too high a UDA target was regularly cited as a barrier for some. And that would lead on to us having the discussion about whether really, this dentist should perhaps reduce their UDA target to allow more time to offer options, which we are both obliged to do, but actually also, is a good idea and really important to develop the private side of your practice, which can lead to a more enjoyable and long-term sustainable and healthy balance. In any case, at the moment, when everyone's doing quite well with their targets, it is a perfect opportunity to start to, embed those core values of offering options and developing the private side of your practice. Confidence. Lacking confidence is something that has been mentioned quite often. It is sometimes to do with the actual procedure, and it is pretty easy fix really. If it is a procedural thing, then go on courses or shadow a colleague. But sometimes it's actually lacking confidence in actually just explaining the differences between options. So what I would say in that instance is read up on it, become really informed about the different materials you're using so that you can convincingly explain the differences between the options you are offering. You need to believe in what you are offering. Okay. Of the various options, is this particular option what you would want yourself? Is it what you would offer your mother, your father, your son, your daughter? We need to truly believe that what we are offering is what we would like ourselves. Moving on, we can often assume a patient will say they want NHS treatment. We do need to remove all elements of judgment and offer private options to every patient. We've mentioned earlier, we mustn't think we're doing our patients a favour by concentrating our treatment options on the NHS. This, as we mentioned, isn't always in our patients' best interest, and it isn't for us to decide how they want to spend their money. We do need to offer options all of the time and let them choose. Sometimes people say things are hard to explain. So you have models or examples of crowns, dentures, whatever to show the patient. We all have Volplas cobalt chromes in our drawer. We don't need to explain that it's because they didn't fit that they're there. But these can help illustrate. Also, oral ceramics, they do have a really good model. It shows lots and lots of different types of restorations. It's reasonably expensive, I suppose, at £200. But what I would say, it's, what is it? It's a composite and a half, a composite and a bit. And it's not a very large investment, really, if you want to develop the private side of your practice. Finally, with respect to that, there is an app called DDS GP. It is an iPad app, and it's been developed specifically to help dentists effectively explain conditions and treatment options to patients. It has over, I think, about 200 illustrated demonstrations of dental disease and various treatment procedures and options. It's about $400, but again, not a huge investment to develop that private side of your practice. So essentially, we need to really be offering private options for every patient until it becomes automatic. Moving on to what we refer to as the features, advantages, benefits model. This is a great little model, really. It is, as it says, you think about the features, the advantages and the benefits of every private option. And you can use this model to help explain, what it is, why one thing is better than another, if you like. So let's consider a simple filling. Composite filling, we do them all the time. A feature is that the composite filling is tooth coloured. An advantage, the composite material is more cosmetic than amalgam. And a benefit to the patient, it's not going to be visible that the tooth is present. Sorry, I forgot to put the slide on. Another feature, a composite can be bonded to the tooth surface. An advantage is that because it bonds to the tooth surface, it improves the retention of the filling. And a benefit to the patient is that, well, they don't need to cut into the tooth like they do for amalgam, so it conserves tooth structure. So going through the features and advantages and benefits, we can do it for lots and lots of different procedures, is a really helpful way to allow you to develop a pattern. Just while we're here, a question I sometimes get asked, I think we all think about, is how can I not offer a composite filling on the National Health Service when there isn't enough retention for an amalgam? So I suppose how I tend to answer that is, what I consider is, if a cavity or a former restoration is of such a size that an amalgam will not be easily retained by the tooth, there are options on the National Health Service. They are a gradia, onlay, or a crown. However, there is also the option to have a composite restoration, and this can be on a private basis. And in this case, it will actually be less expensive than the NHS Band 3 option. So, just worth considering how that can be explained and how a patient may, in this instant, actually go for that private option. So moving on, there are many, many things you can use this FABA model for. It might simply be increasing your referrals into the hygienist. It might be for stain removal, or it may be that you will start to offer the option for people to see the hygienist rather than you doing a band 2 perio. You may well find that by offering hygienist options and referrals to other specialists or dentists with special interests, either in your own practice or other Roderick's practices, that you actually become more confident and better at offering private options to patients, for treatments that you will do yourself. So this can be a win-win for you and obviously for the other clinicians also. while we're on this, so going through the list, clearly you can see you can offer it for ceramic crowns over non-precious metal, ceramic onlays over Gradia, various things. But also, of course, we come on to cobalt chromes, and this can be a tricky one. You know, one of the questions I get asked regularly as well is, how do I suggest a patient has a cobalt chrome denture privately when in fact they are entitled to it on the NHS? So yes, we all know that in principle it is available on the NHS if it's deemed the best treatment for the patient in question. In practical terms, though, I have to say I've rarely done them for the following reasons. You know, a cobalt chrome denture is a high precision dental appliance requiring skilled technicians, and resultingly it does command a high laboratory fee. So whilst in surgery as clinicians we go through the exact same stages for an NHS or a private denture case, as best as they might try, for technicians it isn't always compatible to be able to produce such an appliance on an NHS lab budget. And, you know, unfortunately it does regularly lead to ill-fitting frameworks. You know, also what I would say is once you have fitted some high quality private dentures, cobalt chromes, you'll never want anything but that for your patient. So I would even go as far as to say that it might be a reasonable presumption that at some point this might even be removed from the NHS item of service list. So features and advantages and benefits. Whatever way you decide to explain options to your patients using this or not, it is really important that you practice saying your explanation until it sounds confident. It needs to be natural. It needs to sound, you know, that it obviously comes from you. The main areas you'll be focusing on are cosmetics, bonding, conservation of tooth structure. You may even be mentioning having specific times. You know, it may be that you do late evening, early morning appointments or Saturday appointments. But it can be used for many private options. And just before we go on, this little booklet has been developed by Roderick's. It's very useful. It answers a lot of FAQs about NHS claiming, but also has a good section on the FAB model. So moving on, small changes, big benefits. I have just put a few examples in here. So, you know, one private composite a week might cover your weekly diesel costs. One private composite a day can increase your net monthly pay by £1,000. Add in a private crown, whitening, denture, you could potentially increase your net monthly pay by £2,000. It is significant, and I think it's really worth you thinking about what that extra income you generate might mean to you. Just while we're here, actually, you know, one other thing that is sometimes mentioned to me is, why should I not offer a tooth colour crown on a posterior tooth on the NHS? Especially, you know, when the labs sometimes do such crowns at a similar price to a metal one. And my answer to that would be, you know, firstly, as you know, we need to ensure that we offer treatments on the NHS that restore a tooth's form and function and maintains oral health and stability. Now, a non-precious metal crown would perfectly adequately do this. A tooth colour crown in the posterior region would be deemed cosmetic and therefore can be offered on a private basis. Additionally, a full metal crown requires less tooth removal than a porcelain fused to metal or an all ceramic crown, and therefore should also be always be part of the offering mix, as should a full gold crown. And again, this would be available on a private basis. So it's just really about being clear in your head about, yes, what you can offer, and but what we need to do, what we should do, and it's about giving options again. So if any of this is of interest to you, you might be wondering where to start. So how about we SMART goal it? All of you will be familiar with the SMART goals: specific, measurable, achievable, realistic, and timely. So it absolutely, in order to be SMART, needs to be specific. You know, you need to choose what you plan to develop straight away. Is it the pattern to become better at explaining options? Will it perhaps be that you want to start just doing some more private composites or crowns? Have some patients expressed an interest in whitening that you should follow up? It may even be that you really just open up to your mind thinking about offering options to see the hygienist or to specialists. You know, you can start talking about, listen, they can skip the long waiting lists if they see somebody, an oral surgeon privately, whatever. It will just allow you to start thinking about private options, whether it's what you do yourself or refer to others. Measurable, absolutely. You'll see it in your pay. I don't need to say anything more than that. Achievable, I firmly believe so. As mentioned, as little as one composite a day can make a huge difference. And realistic, again, I would say absolutely. If you plan to start doing a full mouth rehab straight away, that might be an issue. But it is about doing what you do on a daily basis, things you're comfortable with: fillings, crowns, dentures. You do these daily. More complex things can be referred, or it may be that you choose to develop yourself going forwards, and you do a course where you will in time do or offer some of these complex things. With regard to timely, the strict meaning of time we've been speaking about SMART goal is setting a timeline for when you will do things, and this is very important. So it's a bit like saying about being specific. You might say, okay, tomorrow I'm going to start offering more options to every patient, or this weekend I'm going to develop a pattern for all the treatments I might offer privately, whatever. But for the purposes of what we're talking about here, from the perspective of ensuring you have time in your diary to do the private treatments you're going to start offering, I really want to focus on making that time and having that time, and diary zoning essentially. What I would say, never has there been more important time or an easier time to incorporate diary zoning into your book. And I say this because if you're a clinician or a practice that has up to now resisted having a smart diary or any form of zoning, you will currently have some form by virtue of the fact that you have AGP and non-AGP clinics. All we're suggesting is to add a couple of more zones in private and emergencies, and it's important to understand that you need both, really. Private slots, it may be that you have early, late, Saturday morning slots. It doesn't really matter, so long as it is protected time owned by you. And only NHS is booked in there if you say so. You may have triaging colleagues or reception that book in private things, and that's fine. A misconception about private zoning sometimes is that it'll lead to an empty diary, and this isn't the case at all. You can release it to be backfilled with National Health Service treatments, but really, if you don't have that protected time, then there's no good a patient saying they would like to go ahead with a private crown, but actually you can't see them for 4 or 5 weeks. Emergency slots. This goes hand in hand and is really important. If you do not have emergency slots, there's a really good chance you will end up agreeing to see emergency patients in your private slot. It needs to be understood by the reception team that it is protected time, and it's really important that you have enough emergency slots. A simple audit of the number of emergencies you see as a practice will allow you to decide whether you need an emergency slot morning and afternoon. Each clinician might need that, or in fact, it may be that you can rotate seeing emergencies throughout the week. It just depends. All practices are different. So really, that's me done, I think. What I would say, the title for this Zoom is Fulfilling Your Potential. Actually, let me just stop the screen sharing here. Yeah, so the title for this Zoom is Fulfilling Your Potential. And I think it's really important and a worthwhile exercise to think about what that looks like for you. If it is linked, as in this context, to generating more private income on a regular basis, how might that affect you going forwards? Might it inspire you to do an Invisalign course or some other course that you have been interested in? Because now that you are offering more private options, you might feel that you have the confidence to actually offer these treatments as well. It might be that it facilitates you the chance to pursue hobbies or other interests outside of dentistry, or even just go on nicer holidays. We're all different and we all have different drivers and desires. So I just really hope that this has given you something to think about and some tools to support you in further developing your potential. Thank you.